I'm Dr. Josh Weitz. I am a triple board-certified physician. I work at Dermatology Associates of Rochester in Rochester, New York, where I'm the CEO and clinical director, and I am a member of the Removery Clinical Advisory Board. Basically, my interest in the field of aesthetics and dermatology came from the relationship that I have with my best friend, who's also my wife. And she's a board-certified dermatologist. By training, I'm board-certified internal medicine, allergy, immunology, as well as anti-aging and regenerative medicine, and fellowship trained in rheumatology as well. And we've always worked really, really well together. And so when I became a doctor, it was all in order to be able to work with her someday. And so we are now fortunate enough to be able to work in the same practice where we have a team of 54 employees that I oversee and supervise. After I joined in 2013, 2014, I decided that I didn't have enough projects and I needed more challenge in my life. And so one of the things that had always fascinated me was tattoos as well as technology. And when you marry technology and tattoos in the medical world, what you end up with is laser tattoo removal. And so what I realized was there really weren't any doctors doing a good job of providing a comfortable, efficient, best-in-class service to their patient population. You know, doctors would historically look down their nose at the patient as, oh, this is going to be painful and you got a tattoo and you're just gonna have to deal with it. And in reality, that wasn't right. It didn't sit well with me. We wanted to create something where we embrace tattoo culture, and people came in and at some point in their life, they got a tattoo and that was the right decision, but now they're at a different point in their life and they want to get rid of their tattoo, and that's the right decision. The history of lasers in medicine is a very interesting history. It really all kind of started at a place called the Wellman Center, or the Wellman Labs, which is a part of Massachusetts General Hospital, or Harvard. And there's a doctor there who's a dermatologist, Dr. Rox Anderson, and he's the individual who's really truly responsible for bringing from the lab into the clinical space the technology that could be used to treat those various conditions. A lot of times when we're thinking about the lasers that are used in cosmetic medicine, we're thinking about different categories of treatment. And so a lot of patients might come in and have laser hair removal. Some patients come in and want to have a resurfacing treatment to improve the quality or texture of their skin. And then you've got the tattoo removal clients. And ultimately, each of the devices that we use to treat those different conditions are a little bit different. Some of the key differences that I think most people know about, or at least should be aware of, have to do with the wavelength of light that's emitted by the laser. In the case of something like hair removal, most often you're encountering a wavelength of light that's 1064 nanometers, or we call it 1064. These are great lasers for hair removal. Now, you can use that same type of laser to achieve other endpoints, such as tattoo removal. Then you get into, well, how fast is the energy delivered, and what's the mechanism that it's delivered by, and that really is what allows us to differentiate from laser to laser. Now, the lasers we use for something like tattoo removal are completely different than the lasers we use for, let's say, resurfacing. In those instances, we're using either a CO2 laser or something called erbium. And both of those are going to be targeting water molecules, whereas the other lasers that I mentioned often will target pigment, or what we would call a chromophore. Honestly, in the field of medicine, it's a bit challenging. As someone who personally has been trained in 4 different medical disciplines and holds board certifications in 3 of those disciplines, I can kind of walk and chew bubblegum at the same time. So being able to do more than one thing doesn't mean I'm less capable or less qualified. However, I do think that it's important to note that when you're working with a company like Removery, part of what's so exciting for me as a doctor is that I'm now surrounded by a group of people who really want to solve key problems that we in the healthcare and medical aesthetic community have encountered when it comes to nuances of tattoo removal. Now, these are things that perhaps someone like myself might figure out on my own, because I read and I study and we do a lot of research. But for the average doctor that's out there performing a laser tattoo removal, they may not have the same access. A place like Removery has access. It has access to the experts. It has access to the entire clinical advisory board that's been put together to help solve some of the most difficult problems in tattoo removal. And I think what's most exciting is that as providers of tattoo removal and tattoo removal alone, we can always ensure that the clients that come in are going to have the focus of our team to the specific concern that they've arrived with. And that really sets us apart, because at the end of the day, you could go somewhere where they do 10 different things and they also do tattoo removal, and you might have a good treatment. But I know that when you come to a place like Removery, it's a great treatment because greatness is what's expected. Having a clinical advisory board really sets us apart. It creates a gold standard by bringing in some of the leading experts on lasers, on treatment, on clinical protocols, safety, efficacy. We're really going to be equipped with both the knowledge, the clinical experience, the expertise to rewrite or begin to write the definitive guide to how tattoo removal should be done and can be done. As clients come in to have a laser tattoo removal treatment, they now are going to be able to know they're getting the best. And to my knowledge, I'm unaware of any other facility that has a true clinical advisory board whose sole focus is on making tattoo removal as efficient, effective, and safe as possible. And that's our core focus. I think it's going to be very exciting to see in the not too distant future, how do we pair devices, right? So we as doctors, we get a device, and with that device, we gain clinical experience. But at some point in time, we need to pay attention to, well, what if we did this plus this? Is it going to be more than the sum of the parts? And more often than not, these studies aren't done. And they're not done because they cost money. And so when you have a company like Removery that says, we want to do research, we want to develop, it's very exciting as a doctor, because now all of a sudden you have a company who's dedicated on finding the best possible process for the patient, which is really what we all want. I'm Dr. Josh Weitz. I'm the Clinical Director and CEO of Dermatology Associates of Rochester. I'm a triple board certified physician. I've joined Removery as part of their Clinical Advisory Board. I'm excited to be here.